What is pharmacology? The study of diseases. The study of drugs and their effects on the body. The study of surgical effects on the body. The study of nutrition. The study of drugs and their effects on the body. Pharmacology is the study of drugs, their mechanisms of action, therapeutic uses, and effects on the body. What does the term bioavailability refer to? The rate at which a drug is metabolized. The proportion of a drug that enters the bloodstream and is available to have an effect. The ability of a drug to bind to receptors. The time it takes a drug to be excreted. The proportion of a drug that enters the bloodstream and is available to have an effect. Bioavailability refers to the proportion of a drug that reaches the bloodstream and is available to produce its intended effect. What organ is primarily responsible for drug metabolism? Kidneys, liver, heart, lungs. The liver. The liver is the primary organ responsible for drug metabolism, where enzymes modify drugs to facilitate their elimination. What is the term for the study of how drugs are absorbed, distributed, metabolized, and excreted? Pharmacodynamics, pharmacokinetics, toxicology, pathophysiology. Pharmacokinetics. Pharmacokinetics is the study of how drugs are absorbed, distributed, metabolized, and excreted by the body. What is the therapeutic index of a drug? The ratio of a drug's toxic dose to its effective dose. The time it takes for a drug to reach peak concentration. The amount of drug needed to produce a therapeutic effect. The percentage of a drug eliminated per hour. The ratio of a drug's toxic dose to its effective dose. The therapeutic index is the ratio of a drug's toxic dose to its effective dose, indicating its safety margin. Which of the following is an example of a drug's mechanism of action? Binding to receptors, excretion through urine, absorption in the stomach, distribution in the bloodstream. Binding to receptors. A drug's mechanism of action refers to how it produces its effects, such as binding to receptors to activate or inhibit them. What is the term for the unintended effects of a drug? Therapeutic effects, side effects, bioavailability, pharmacodynamics. Side effects. Side effects are unintended effects of a drug that occur in addition to its intended therapeutic effects. What class of drugs is used to lower blood pressure? Antibiotics, antihypertensives, anticoagulants, antidepressants. Antihypertensives. Antihypertensives are drugs used to lower blood pressure by various mechanisms, such as relaxing blood vessels or reducing heart rate. What is the primary function of diuretics? Increase urine production, reduce inflammation, lower cholesterol levels, increase heart rate. Increase urine production. Diuretics increase urine production, helping the body eliminate excess fluid and reduce blood pressure. What does the term agonist mean in pharmacology? A drug that blocks receptor activity. A drug that enhances receptor activity. A drug that is metabolized quickly. A drug that has no effect on receptors. A drug that enhances receptor activity. An agonist is a drug that binds to a receptor and activates it, enhancing its activity. Which of the following is an example of a drug route of administration? Oral, metabolism, excretion, absorption. Oral. Oral administration is a common route of drug delivery, where the drug is taken by mouth and absorbed through the digestive system. What is the term for the time it takes for a drug's concentration to reduce by half in the body? Therapeutic index, half-life, bioavailability, onset of action. Half-life. The half-life of a drug is the time it takes for its concentration in the body to decrease by half, which helps determine dosing intervals. Which of the following is a common side effect of opioids? Diarrhea, constipation, increased heart rate, insomnia. Constipation. Constipation is a common side effect of opioids due to their action on the gastrointestinal tract, slowing down mobility. What is the primary action of antibiotics? Kill or inhibit the growth of bacteria. Reduce inflammation. Lower blood pressure. Increase insulin production. Kill or inhibit the growth of bacteria. Antibiotics kill or inhibit the growth of bacteria, helping to treat bacterial infections. Which medication is commonly used to reverse opioid overdose? Naloxone, metformin, warfarin, omeprazole. Naloxone. Naloxone is an opioid antagonist that rapidly reverses the effects of opioid overdose by binding to opioid receptors without activating them. Thanks for watching. Don't forget to like and subscribe for more.